Hey guys, welcome to another episode of Health Matters with yours truly, Danielle Linane. Today I sit down with Dr. Quaneecia Rainey, a clinical psychologist here at Wellstar Keystone Hospital, whose passion in chronic disease management through behavioral health truly shines in this interview. You are in for a treat. Grab your pens and listen in. Today we are sitting down with Dr. Quaneecia Rainey, just happens to be a good friend of mine. Very excited for you guys to hear a little bit about Dr. Rainey, and we're going to be talking specifically about mental health and behavioral health today. Welcome, Dr. Rainey.
Thank you so much for having me.
Oh, absolutely, it's a pleasure. So I always like to start out, tell our listeners a little bit about yourself, your background, education, where you came from, and then kind of what brought you, how you got to Wellstar.
Yeah, so my education background is that I have a bachelor's degree in psychology from Dillard University. It's a small liberal arts college in New Orleans. And then I went to graduate school and got my PhD in psychology from Washington State University, which is up in the Northwest.
Big move.
Huge move. We'll talk about that another time. So that's my education background. Prior to coming to Wellstar, a lot of the work that I'd done before was with young adults. And if you know anything about that population, you've got to be ready for anything.
Oh, never a dull moment?
Never a dull moment. So I worked with, everything from eating disorders to substance abuse, depression, anxiety. You name it. You've got to kind of be a jack of all trades in working with that population. And so kind of moving on here to Wellstar, I kind of needed those tools here too. The only difference is now I'm sort of combining that piece of things with chronic disease management. And so oftentimes my patients will have hypertension or diabetes, and they've got one of those other things too, right? Depression, anxiety, substance use, eating disorder.
Right.
So it's kind of bridging both worlds.
So what made you want to make that transition? Because, correct me if I'm wrong, but you don't normally see a lot of chronic disease management in the young adult, right?
Right. Yeah, most of the patients that I worked with previously in the young adult population are pretty healthy. Right? You're right. You don't see chronic disease. And so I've always just sort of been interested in that. It's challenging. And I was at a point in my career where I was really looking to do more, experience something that was different and new and challenging, but that could still use kind of the foundation of my skill set. And so when the Wellstar opportunity came along, it seemed like it would be a good fit for me and really exciting.
Oh, so now tell everyone what you do for Wellstar right now. Where are you at?
So right now I am at the Center for Best Health, the Marietta office, because we've now branched out to East Cobb and West Cobb and Vinings and Ackworth.
Yep.
So we're all over.
Everywhere, taking over the world.
So I am at the original location, which is here in Marietta. I am a clinical psychologist, and so I primarily do behavior modification with our patient population, but also some short-term psychotherapy as well.
Okay. So Center for Best Health is a metabolic and weight loss clinic. So what they do there is you work with a multidisciplinary team. You've got your physician or nurse practitioner who kind of sets your plan. Then you have the exercise physiologist, registered dietitian, and yourself. So talk about that model a little bit and why it seems to work so well, if you don't mind.
Yeah, that's a great question. So what we found is that patient outcomes are just better when you've got a multidisciplinary team like the one we have. And so oftentimes our patients come in with a variety of different problem areas that I alone as a psychologist cannot address. And so I need a physician colleague to help with the medical stuff. I need a dietitian because she knows nutrition stuff that I don't know. I need an exercise person. So I think we all bring sort of this unique piece to the table that patients absolutely need, and I don't think would be as successful 100%. Without the whole team.
Absolutely. So a little background, Dr. Rainey and I actually worked together at the Center for Best Health. I was the exercise physiologist, and from an exercise standpoint, there were sometimes people, they want to talk, and it's like, Dr. Rainey can help you with that, not me. So it was a good thing from a other provider standpoint to be able to know that the patients are in good hands, because I can't do what you do. Nor do I want to. No offense.
Everybody has a particular skill set that they bring to the team that's unique, that's much needed for the patients, and patients benefit.
Absolutely. So tell me a little bit about what made the weight loss and the bariatric or obesity medicine, what made that interesting to you? What made you kind of want to, I know you said chronic disease management, but what?
So, I think when you think about the Center for Best Health, a lot of people just think, oh, that's where you go if you want to lose weight. And I guess I see it a little bit more broadly than that, at least from my perspective. When I'm working with patients, my primary goal isn't necessarily to help them lose weight.
Right.
I'm trying to help them change any sort of behavioral problems that's causing problems with their chronic disease management, or any sort of mental health problems that's impacting their quality of life. So that is my primary goal, is to give people tools and skills to make changes to improve their health and their quality of life. If they lose weight, which they typically do, with those skills, I'm happy about that.
Bonus.
That's a bonus, right? But primarily, that isn't always the goal.
Right, absolutely. And that kind of translates, I'm hearing, across even with your young adults, right? Like that can kind of, it's really about supplying people with the tools that they need to live a happy, healthy life.
Right.
Correct?
Quality of life and health are key pieces. That's ultimately my goal, is to help people manage their health and help people have a quality of life that they're satisfied with, that aligns with their values for their life.
Right.
And oftentimes when they make changes in support of those things, they do tend to lose weight and get healthy.
Right. It just kind of, it's one of those, is it the chicken or the egg, right? I
think it's a byproduct of the process.
Yes. Absolutely. So this question, I love asking people this question. What are some of your favorite aspects of what you do, and maybe just, behavioral health in general, and what are some of the biggest challenges you see?
That's a good one. I would say the part of my work that brings me the most joy is absolutely being able to help people change their lives.
That aha moment?
Right?
When it
that
happens?
moment where someone comes back and they say, Dr. Rainey, oh my God, I tried that thing you recommended and it worked, and now my sleep is so much better, and now I have energy and I can exercise, and I've been going to the gym. That's what just gives me so much joy, is when I can help someone do something for themselves that maybe they didn't know they could do, or maybe they had been struggling with. So that's by far my favorite part.
Yep.
I would say, kind of on the other end of that spectrum, is kind of the reality that sometimes people won't get better, right? Even with a whole team that includes myself and the doctor and sometimes people won't get better. And that's kind of a harsh reality, I think, of not just for me as a psychologist, but also any medical professional. That's the reality. And so sometimes that's really difficult when you're working really hard and you're trying and you're supporting and you're giving all the tools, and it just doesn't seem to be working, at least not in that moment.
So maybe timing too,
Some timings. I think, sometimes I'm just planting the seed.
Yep.
Right?
Yep.
And so maybe we're not seeing the change happen now in my time with that patient, but hopefully I've planted a seed, and sometimes they come back around, right? Yeah. So that's all you can do.
Exactly. Thank you. That's really insightful. So what I'm kind of going to focus on these, next few questions or bullet points I have in front of you there. I want to talk about behavioral health in a couple of ways. First, what is the difference between a psychiatrist and a psychologist? Because you get that a lot from just people that don't work in the medical field. What is the difference?
Yeah, I can't tell you how many people come to see me and they think I'm a psychiatrist. And I'm like, well, no, I'm not a psychiatrist. I'm a psychologist. And then they give me that really confused look like, are they not the same thing? So here's the difference. And there's a significant difference.
Yes.
So a psychologist is someone who has a doctorate degree in psychology. And so that's either a PhD in psychology or a PsyD, which is called a doctorate of psychology.
Okay.
And so you're licensed at the state level, and part of the requirement for licensure as a psychologist is you've got to have a doctorate degree.
So what's the difference between the two degrees? Is there really one, or?
There's a little bit of a difference. So a PhD has been around for forever, right?
Right.
And the difference is that a PhD has more of a research focus, right? So not only are you being trained as a practitioner or a provider of psychotherapy, you're also being trained as a scientist and a researcher.
Okay.
And so oftentimes you'll have someone going into a PhD program in psychology who does not want to work with patients at all.
Right.
They don't want to provide direct care.
Just want to do research.
They want to work at a university and do research and publish articles and teach. And so you get that training in a PhD program.
Okay.
A PsyD program, you pretty much are mostly getting clinical training. So you're getting trained as a therapist, as a clinical provider to go out and provide psychotherapeutic interventions, not as much research training.
Now, you are a PhD, correct?
Yes.
And you spent a little bit time at Quaneecia State, correct?
I did.
Now, did you do both there, or were you just...
I did do both there.
Okay.
I primarily, my full-time role was in the counseling center, working directly with that young adult population.
Okay.
But I also did some teaching as well.
Okay. Oh, cool. That's cool. Did you like that?
I did.
Did you?
I did.
I could totally see you as a teacher. I could totally
I don't
see
know
you
if my
as a
students
teacher.
would agree, but...
All right. So the psychologist, what does a psychologist do?
Okay, so a psychologist primarily provides what we call talk therapy, right? So all of the interventions that we're going to provide, generally they are empirically validated, and it's talk, right? It's me providing tools and skills, and the modality that I'm using is we're talking back and forth. There's no medical intervention, if you will.
When you say empirically validated, you're meaning research, right?
Research, yes.
So it's all evidence-based.
It's evidence-based. We're using the literature, let's say, on diabetes management to create a treatment plan that's based on the literature around diabetes management. So it's not something that, we're just sort of shooting the breeze when we're in a session.
Hey,
we're
I
actually
heard this on a podcast the other day. Let's try it.
Right. We're not doing that. We're using evidence-based interventions to deliver treatments that we know work.
Okay. All right. And so then psychiatry.
So psychiatry, a psychiatrist is a medical doctor. So they have an MD. Right?
Fun
They've
fact.
gone to medical school.
Okay.
So they have all the training as any other physician, but they have specialty training in psychopharmacology, right? So they know specifically about medications that help people who have mental health problems, basically.
So is that going to be like antidepressants, anti-anxiety, those types of medications?
Absolutely.
Okay.
They have specialty training in those medications. So primarily, when you go to see a psychiatrist, the intervention is going to be medication.
Okay. Without the psychotherapy piece.
Right.
Okay.
You might get a little bit of psychotherapy,
okay,
but primarily it's going to be medication.
I don't think I ever knew that until just now.
Really?
I don't think I ever knew that. Mm-hmm. So we're going to talk about this a lot because I love talking about this with you, but the term, I'm using air quotes, you guys can't see me, but the term therapy, that is going to be psychology.
Yes.
Right? And then psychiatry is going to be more medication management.
Yes.
Correct.
Yes.
Okay.
And with a psychiatrist, you may get some skills, right? They may spend a little bit of time with you on providing some maybe breathing strategies for anxiety. But they don't have a lot of time, right? They're physicians.
Right.
And so most of their time with you is going to be spent evaluating, is your medication working? What do we need to change to make it work best for you?
Got it.
And the skills and the tools piece primarily falls with a psychologist.
So can you give us, well, I guess the better question is there like an example of a type of patient that would go psychiatry versus psychology, or is it really patient choice?
So it's not really psychiatry versus psychology.
Okay.
Generally, if a patient is seeing a psychiatrist, they could probably benefit from seeing a psychologist,
correct,
right?
Yeah.
Again, going back to treatment outcomes, medication alone is helpful, but much more helpful when you have some psychotherapy as well.
Correct.
And so part of it is patient preference. Sometimes people come in absolutely wanting some medication. Sometimes they don't want medication at all.
Right.
So part of it is patient preference, but then also what's most helpful is that if we're dealing with, let's say, depression, for example, mild depression probably won't require an antidepressant, right? That's more psychotherapy.
Okay.
But if we're talking kind of more moderate to severe depression that's been pretty chronic, then maybe that's where we need to consider adding some medication along with psychotherapy.
Got it. Okay. That's a great example. Because I think I hear that a lot. It's like, well, where do I go? Well, I don't know. I don't know which one, So that's really good. I appreciate that. So now we kind of move into the air quotes of therapy, and I'm like giving a shoulder shrug and doing the air quotes because there's a stigma around it, correct?
Yeah.
And it's an unhealthy stigma. I am a huge fan of therapy. I say that slowly and use my air quotes again. But I want to talk about not only how behavioral health is growing, I feel it's really growing, but why do you think that stigma exists? Where do you think that comes from?
I think the stigma it's been around, for mental health for forever. And I think part of it is probably the representation in the media, right? Yeah. What comes to mind for me when I think about stigma is that old movie, One Flew Over the Cuckoo's Nest.
Yeah.
Right? If that's the portrayal of mental illness, then of course people are going to have a stigma.
Well,
right?
People, I think, automatically think mentally ill. They think like
institutionalized.
Yes,
yeah.
They're like split personality or schizophrenia.
Absolutely.
Some of the more extreme cases.
Right.
But that's not really all mental illness.
Absolutely.
Correct. It's not what it is.
It's a continuum.
Right.
You've got mild all the way to severe, depending on the issue. And so, I think oftentimes. What has been shown, I think, in the media, in the mass media, is sort of more on the severe end. Also, I think just maybe in your community, you've seen, maybe a homeless person that's talking to themselves. And so you get the image in your head of, like, that's what mental illness is.
Right.
Like, you're homeless and you're on the corner and you're talking to yourself.
Right.
When that's not the majority of it, right?
Right.
So I think that's part of the stigma is sort of the representations that we've been exposed to.
Absolutely. Do you think the stigma has evolved? I mean, what have you seen? And since and if you don't mind me asking, how long have you been practicing?
So I've, let's see here. I got to think about that. So I finished graduate school in 2011 and got licensed in 2013.
All right. So 6 years.
6 years.
So 6 years you've been practicing. So over the past 6 years, what have you seen as far as the evolution of behavioral health?
I do agree with you that I think it's growing, and I think the stigma is still there, but I think there is much more talk about therapy and mental health, and even if you sort of look within Wellstar, right, you've seen the growth of behavioral health. Even within Wellstar, you're seeing psychologists and social workers in primary care clinics. You're seeing, we're in oncology and CVM, right? And so I think there's kind of a growing recognition that this is something that psychologists and other mental health providers can impact, and we can have a role in helping people to get better.
Absolutely, because specifically, you look at you're stationed in, bariatrics, and then you have cardiology. Both of those patients, even if they do have genetic predispositions to their chronic diseases, lifestyle modification will help lessen that, right?
Absolutely.
In the primary care office, I'm not familiar. How do psychologists kind of help support that team there?
So, my understanding, at least in terms of Wellstar, is I believe there's about 6 maybe primary care offices that have what's called behavioral health coordinators stationed within the primary care offices. And their role is to partner with their physician colleagues to treat some of the mental health stuff that comes right in the front door.
Mild depression that you may be talking,
that may come in and say, hey, I'm just not feeling well, I'm struggling, or maybe they just lost someone and so they've got some grief or some substance abuse. And so partnering with the physician to address some of those mental health concerns right there in the office, where you don't have to give them a referral and send them somewhere
to the call center,
right, or that they're not going to go, right? You follow up 6 months later, did you go? And, well, no, I don't, And so having someone right there who you can go ahead and do a warm handoff, you can meet that day, build that rapport, you're creating more access to care. Right.
Absolutely. And it's very great to see that happening. So back to I want to go back to the stigma a little bit with that. I know I got off my notes. Shocking. It's what I do. But what strides do you think we as practitioners, and I say we in there too, and the way that I thought of this question and when I was kind of brainstorming these is when you look at the obesity epidemic, when you look at the diabetes prevalence across, what do you think as practitioners? We spoke with a hospitalist earlier, and the hospital's even moving to a comprehensive approach. How do you think that comprehensive unit has helped with the stigma and helped to kind of lessen the, I'm in therapy, it's fine, it's helping? Did you get what I'm saying there? Like, could you speak on that? Or?
Well, I think, I'm not sure that the sort of the comprehensive unit alone has been what's helped with the stigma. I certainly think that when a patient comes in to, let's say, my clinic, and they're coming in specifically for weight management, and then they're also told, by the way, there's a psychologist in the clinic. Oftentimes patients are surprised and they're like, what do I need a psychologist for? So I think to some degree, having psychologists and other behavioral health professionals embedded in the clinic does help sort of at least create more access and creates the discussion and the conversation about how a behavioral health professional can be helpful.
Right.
And maybe in that way, it sort of decreases the stigma. But I also think just sort of routinely asking about mental health in the health field, right?
Now, is
in
that
the medical
something,
field.
is that something that primary care physicians are doing now?
Absolutely, they're
Interesting.
doing that.
Yeah.
Because many times, people that are pretty healthy are probably seeing their physician once a year for an annual checkup.
Guilty.
Right?
That's me. Yeah.
And
right now, at least.
Generally, that appointment is you get a physical,
Right.
maybe do some blood work.
Maybe,
Right?
Yeah, absolutely.
But now we're starting to ask in that visit, right? Let's check in on your mental health. Let's do a pulse check. Let's make sure there's no depression going on. Let's make sure you're not having thoughts about suicide.
Right.
So that is now starting to happen in that once a year physical. And I think the more that happens, that becomes so routine and it's expected. Just like I get my annual physical, I also get my annual mental health checkup at the same time.
Right. That's really, I see. So I don't, that shows you guilty. I see my physician once a year for my yearly. So I'm good with that. But that's something I don't think I realized we checked on normal, like regularly. So that's really good.
Yeah, that's, Wellstar actually rolled out the Zero Suicide Initiative last year.
Oh.
And so as part of that, primary care physicians and probably some other providers as well, other disciplines, are assessing for depression and suicide at those visits.
Awesome. So in a perfect world, I know, and a mean question, what would in 10 years, let's say, trajectory, how do you see behavioral health evolving, changing? You see some, and so I use the example of, this like concierge medicine where these physicians are going to homes, which I guess isn't really new because you used to do that in the old days, and the doctors would come to the house and check on you. How would you see behavioral health evolving?
I think it's already starting to evolve in a similar way in terms of teletherapy and telemental health.
Okay.
That's already an area that's growing tremendously.
So is it like a telemedicine visit where it's all on the phone and it's just, do you do video conferencing or just telephonic? How does that work?
So both.
Okay.
Both. I'm not doing any of that. That's
Okay.
not a part of what Wellstar providers provide here. But in the community, there are providers that are doing both video and telephone sessions.
Interesting. That's really, so then you can really talk about expanding, your breadth, your reach.
Right.
That's interesting. That's really interesting. So if our listeners want to find you, look you up, or ask some behavioral health questions, would the Wellstar website be the best way to go?
That would be the best way to find me.
Okay, and she'll have a nice little picture right there, guys. I'll link that up in the show notes for you so that you can see her. If you have any questions directly for Dr. Rainey, shoot them over to me, and I'll make sure that she gets them and we can respond. And again, that's just health365@wellstar.org. Just shoot me an email. And Dr. Rainey, thank you so much for coming in today. It's always a pleasure sitting and getting to chat with you.
You are so welcome. Thank you so much for having me.
All right, no problem. All right, see you later, guys.